My dear viewers, hello everyone. My name is Emad Bishay. I'm a board-certified internist in practice for the last 20 years in the USA. I am the director of Seacoast Home Care Company as well as Seacoast Hospice. I'm also hospitalist in numerous hospitals in California. The topic is very hot today as we are speaking about coronavirus. Coronavirus is almost the most contagious we have ever seen in the last several years. Coronavirus has affected 600,000 in the world as we speak, with close to 30,000 deaths, with a percentage of 5% people infected with coronavirus have already expired. It's extremely scary virus and a hot topic, and I feel that 7 billion people in the world under siege by the coronavirus. Coronavirus has affected 199 countries in the world. Unfortunately, the beautiful USA is a top number of infected cases with 100,000 infected, proven infected patients with coronavirus in the USA, with 1,500 deaths so far. The coronavirus has affected Italy harshly with 81,000 infected patients with 9,000 deaths with 12% mortality rate. Next to that comes China with 81,000 infected people with 3,200 deaths. Then Spain with 64,000 infected persons and 4,500 deaths. And then Iran has about 2,000 deaths. Comes after that 199 countries all affected by coronavirus. As President Trump has noted, we are fighting a big battle against invisible enemy. So let's talk for a few minutes about this invisible enemy. What is coronavirus? What is the message to take? Should we all be scared or should we have hope? My early message is be careful, cautious, vigilant, have social distance, but be hopeful and do not panic. Let's talk for a few minutes about coronavirus. Coronavirus, as we see, is an RNA virus related to SARS virus. As you all remember, SARS in 2003 is an RNA virus, and novel coronavirus or COVID-19 is a related virus. As we see here, the virus has a capsule and spikes like we see on the photo. These spikes play a big role in the way coronavirus attack humans. This is another view of the virus with all the spikes, what we call it spike glycoprotein or glycoprotein S. These spikes attach to a receptor in our body, particularly in the lungs, called angiotensin receptor. It's exactly like a key and a lock. The key that opens this lock is the spike glycoprotein, and the lock is the angiotensin receptor. Once the virus goes into our lungs, it hijacks the cells, damages the alveoli, causes a tremendous immune reaction, lots of cytokines, lots of horrible immune reaction happens, ending with the alveoli not healthy and causing ARDS, which is acute respiratory distress syndrome. The virus, once it attacks, it has incubation period from 2 days to 14 days. And there's a lot of asymptomatic carriers. Person could get infected and start usually around the 5th or 6th day showing symptoms. Most of the symptoms could be a headache, sneezing, coughing, shortness of breath, later on respiratory failure, need for intubation, ARDS, pneumonia, septic shock, and death. The most triad I tell patients and my fellow colleagues, doctors and nurses, and I take a minute to give them applause. They are the front line. They are the soldiers, particularly every emergency room doctor working in California, New York, and Louisiana. These are the three most hit parts, with New York being 50% of infected cases in the US, estimated about 50,000 infected people in New York. And half of the deaths occurs in New York. The virus starts with a fever in 88% of cases, has fever, has dry cough, has sore throat, has shortness of breath. The main triad is fever, cough, and shortness of breath. If you or any loved ones has all this triad, be very careful because you could be infected with coronavirus. Coronavirus is very highly transmissible and contagious. It's mainly respiratory virus. It gets transmitted by the large droplet. So being around some infected person, sneezing or coughing, these droplets, you can get the infection from it. Or it can last on the surfaces as well for several hours, and by touching any surface and then touching mucous membranes or your ear or nose or face, you can get infected. For that reason, we advise for social distance as well as cleaning, frequent hand washing, clean all the surfaces, wherever you work, your office, your computer, your stethoscope, your medical equipment, cleaning with Clorox or alcohol, and vitamin C and having boost your immunity is the key to avoid this virus. This slide shows us how the virus affects almost every part of the body, particularly the lungs. It can 88% occur with fever. It starts in the throat and harbor the throat for 4 or 5 days. Usually goes to the lung by the 8th or 10th days. After 10 days, you could have critical illness and pneumonia and severe shortness of breath and acute hypoxic respiratory failure requiring intubation from ARDS. Note the virus will attack your lung and start replication and hijack your lungs and make the alveoli not permitting air exchange, basically almost like you're drowning. Lots of secretions. ARDS starts acute respiratory distress syndrome and need intubation. And I have to say that intubation has to be with certain measures. Prone position is better. We do not want high tidal volume. It's extremely dangerous virus and cannot be taken lightly. Next slides show us Paris, Eiffel Tower, with nobody around it. The virus has affected numerous countries and social distance. Almost the whole world is watching carefully with a great fear. And it's almost the deadliest virus since 1918 when we had the Spanish flu that took 50 million people. This is a place in Europe where before the virus, it's a tourist area in Italy, and after the virus, you can see it's deserted. This is how it started in China, and you can see the medical team is fully equipped with personal protective equipment. As you can tell, it's a contact isolation and respiratory isolation. From head to toe, you need contact isolation, you need gloves, you need a gown, you need a goggle, you need N95 respiratory equipment for isolation. As we spoke about Wuhan, where the virus originated, it's time to present the photo of the courageous Chinese doctor who started checking about this virus. Unfortunately, that doctor has expired himself in February after being infected with COVID-19. COVID-19 presents with numerous presentations, mostly shortness of breath and hypoxia. Clinical course, as I told you, incubation period from 2 to 14 days. Usually 5 days after exposure, person present with flu-like symptoms. 81% of cases are mild symptoms, 14% severe symptoms, 5% critical symptoms including ARDS, intubation, and death. Lab results could help the ER physician or the internist. 15% of the cases may have cardiac involvement, including pericarditis, myocarditis, atrial fibrillation with new onset, elevated troponin. With the COVID-19 in mind, we cannot take those patients to the cath lab. As I mentioned, chest X-ray and CAT scan are crucial in showing viral pneumonia, interstitial infiltrates, ground glass appearance. In addition, lab results can give us a clue. White blood cells usually low. Lymphocytes are very low in lymphopenia in 95% of cases. Platelets are also low. CRP and ferritin are elevated and it's worthwhile to check them. CPK, D-dimer, LDH, alkaline phosphatase, AST, ALT are commonly elevated. Basically, if you have seen a bilateral pneumonia in a typical scenario with elevated CRP, immediately think of COVID-19. So we need to stop the COVID-19. The first advice, stay at home. If you cannot and do not have an urgency to leave the house, only go to see your doctor or buy your groceries. Next, avoid crowded places. Make sure you have enough medication if you are taking diabetes medication or heart medication or blood pressure medication. Keep away for those who are sick or coughing or have been just coming from infected areas. Avoid non-essential travels. And often, I cannot reinforce that, clean all the surfaces, wash your hands with soap and water for 20 seconds at least. Be very careful and very thorough in cleaning, sanitizing every place you go to, and especially your hands. Another one, boosts your immunity. This slide is magnificent. Do not drink much, work out, eat healthy food, vegetables, mostly green stuff, lemon, tangerine, orange. Boost your vitamin C. We would like your vitamin C. Almost taking 2,000 milligram vitamin C daily. Boost your vitamin D, vitamin E, multivitamin a day, maybe 5,000 international units of vitamin D. The next mode of prophylaxis is a vaccine. We started numerous trials, started in Seattle. We have volunteers, 45 people already have started the vaccine. They got the first shot, another shot in 4 weeks. Then we have a bigger study coming. We're hopeful, since we have the RNA virus, to start the vaccine in a year and a half. This is a hot topic, how we treat the virus. There is numerous studies about chloroquine and hydroxychloroquine, well-known malaria prophylaxis treatment and systemic lupus erythematosus and rheumatoid arthritis treatment. It's been 70 years, and we know it's been well tested. The study was done in France. 26 patients has taken chloroquine or hydroxychloroquine. Some of them taken hydroxychloroquine and azithromycin together. Out of this is very encouraging study. The person who took hydroxychloroquine and azithromycin, Z-Pak, has shed out of the virus within 6 days. They were free of symptoms and no more virus detected. It's excellent news and encouraging study. However, it's anecdotal and it's still early on. The dose of hydroxychloroquine is 400 twice a day for the first day and 200 twice a day for 4 more days, total of 5 days. The dose of the azithromycin is 500 milligram first day and 250 every day for 4 days. We're hopeful that this treatment could save lives and at least protect people from going into sick phase or ARDS. The other treatments are Kaletra, which is ritonavir, and lopinavir. These are medicine we use for HIV. We used this medicine for Ebola virus before. Lopinavir is 400 milligram twice a day and ritonavir 100 milligram twice a day. we are starting to treat patients and do studies around that. Interferon is another potential treatment. We've used that for hepatitis C as immune modulator. The HIV medication work by protease inhibitor. Another big one, remdesivir. Remdesivir is experimental nucleotide analog. It helps prevent the replication of the virus. Once we prevent the virus from replication, then we can stop the dangerous effect of the virus. Another one, Pavir influenza. We use that in influenza. It's an RNA polymerase inhibitor. That's also being used. Another one, tocilizumab, is a rheumatoid arthritis medication, anti-inflammatory. It's approved. We can use that in certain cases to decrease the inflammation among people with ARDS, in addition to ventilator and respiratory support. In summary, coronavirus is extremely dangerous, extremely transmissible, extremely contagious. Let's all fight it together with prophylaxis, with staying safe, with safe distance, with frequent washing of our hands and sanitization for all equipment, with more trial about the new medicine like I outlined. My best hope for all of us to stay safe and stay positive and don't panic, and together we will fight coronavirus. Thank you so much for watching. I hope you have learned something from this video. There will be more videos coming, and most of these videos are funded by the Seacoast Home Care Company and Seacoast Hospice. If you have any patient or need a referral in this difficult time, please contact the number that will appear on the screen. We will be very happy to send nurses to your home anywhere in San Diego County and Temecula, Murrieta, Lake Elsinore, almost to Riverside. Thank you so much for viewing, and please watch, stay tuned for more videos to come. Thank you.